Welcome to Health and Harmony Beyond the Teeth, where we dive into all subjects that will help you become healthier and happier. As a dentist, I believe dentistry is more than just teeth. So I created this show to focus on overall health. We will hear from leading experts about eating better, exercising better, breathing better, and sleeping better. We want to help you create harmony in your life so you can live your life to the fullest. We want you to thrive. Hello, welcome to Health and Harmony Beyond the Teeth. I'm your host, Dr. Hal Stewart, CEO of the Stewart Center for Optimal Health, where we help people breathe better, we help them sleep better, we help them feel better, we help them live better. We do this by growing beautiful jaws and beautiful faces. You know, as a trained dentist, I realized long ago that there's much more to health than just dental health. As dentists, we kind of live in a cocoon where it's all about dental health. Well, and we also get frustrated when we hear that, dental problems are separate from medical problems. They're not. And I'm very proud of my profession in that we are really the leaders in the movement of educating the public on how important the oral systemic connection is. And that's really a redundant term because it's all systemic, but the oral cavity and the nose, what are the two most important things that we do, that we have to live? We have to breathe. We breathe through our nose primarily, should be through our nose. We can breathe through our mouth when we have to, and unfortunately, the cause of a lot of health issues is people breathing through their mouth too much. And we've talked about that many times on this podcast. But what else do we do with our mouth? We eat. So sustenance and oxygen, two things that we have to have regardless of anything else. If we don't have those, we're not going to be around long. If we don't have oxygen, we're not going to be around for more than 2 or 3, 4 minutes, maybe 5, if you're a world-class athlete. If you don't have food, you'll be gone. You may can linger on for a month, but then you'll be gone. So this is a very, very important part of our health. And it really is where health starts and where it can end, where it can go bad. So there is this oral systemic connection. And today I have our friend and great colleague, Dr. Gina Pritchard, with us. She's been on the show before. Dr. Pritchard is a nurse practitioner that has her own clinic in Frisco, Texas, the Prevent Clinic. We'll put her contact information at the bottom of the screen near the end of the podcast. But Dr. Pritchard has made it her lifelong journey to help people be healthy and prevent diseases before they occur. Sometimes, about the time the patient comes and sees Dr. Pritchard, they've already had a heart attack or a stroke. But she can help them prevent that from ever happening again. So we now know that heart attacks, strokes, aneurysms, for the most part, that can all be prevented. Today, we'd like to focus on more of the oral systemic issue. I've taught for years, as being an expert in sleep and sleep apnea, that having sleep apnea and having cardiovascular disease, many people that die during the middle of the night that are already compromised with the cardiovascular disease die of an apneic event. And so, preventing sleep apnea can save lives, but Dr. Pritchard takes it one step further in that this oral systemic connection can actually be one of the causes of cardiovascular disease in the first place. So that's what we want to focus on today. So Dr. Pritchard, welcome back. It's good to have you.
Thank you. It's great to be here.
So this oral systemic connection, why don't you elaborate on that a little bit for us?
Yes. So when we spoke on our podcast earlier, we talked about cardiovascular disease, cerebral vascular disease, disease of the arteries, the life-giving blood vessels in our body called the arteries that carry the nutrients and the oxygen to every cell in our body. So I just want to elaborate on that a little bit further today, particularly as you talked about the oral and airway systemic connection. So we mentioned earlier that looking at the blood vessels and finding early stage plaque is very important because it's those small areas of plaque that can rupture and take your life. And then taking it one step back, trying to figure out all of the root causes that contribute to plaque formation in the first place. So even if you're someone 20, 30, or 40, or 50, but say, I have a family history for heart disease, if we look at your arteries and they look beautiful, we still want to identify every potential risk factor and root cause and address that thoroughly to make sure that you don't start to develop plaque. So we talked about the Dr. Bradley Bale and Dr. Amy Doneen, the BaleDoneen method. So we have a slide that sort of in one slide depicts this life-saving approach to arterial health, if you will, preventing heart attacks, strokes, and dementia through the BaleDoneen method. So this tree exemplifies what can be a healthy artery or could be an inflamed artery. On one side of the tree, again, we've got the cross section of a blood vessel that's got a healthy wall and a wide open pipe, if you will. And then as you move across the branches of the tree, you can see that plaque has begun to form and the wall is thickened in the artery. So the blood flow is compromised to any cell in the body. Actually, what we're talking about is keeping every cell in the body perfectly healthy. You have to have oxygen, as you said earlier, and you have to have nutrients every minute of every day to every cell in the body. So these blood vessels are incredibly important. So you start to get thickening of the wall. Then you can get rupture of that thickening in the wall. That's plaque rupture, and that's what can lead to big problems real quick. This thickening can still lead to big problems, but it's silent. Unless someone looks, you don't know that this thickening in the wall of your arteries is occurring. So as you'll see there on the trunk of the tree, it says inflammation. We know that inflammation is the driver of all disease, all chronic disease, cancer, diabetes, and Alzheimer's and cardiovascular diseases we've talked about. But then where the life-saving work really begins is to look at those root causes. And so we've listed several of them there. They're not all listed. There's 40 or 50 root causes. Most people have on average 20, but we've circled 2 of 3 of them there. We're talking about this oral systemic relationship. So whenever I see someone and am guaranteeing them a life free of heart attack or stroke, I can't do that alone. I have to have a dental colleague such as Dr. Stewart and his team that's taking care of those root causes that I can't treat. Some of them I can identify, but I certainly can't adequately treat them. So talking about the oral systemic connection, you mentioned it earlier, airway, or how well someone is oxygenating during the day and at night while they sleep, as well as the health of the mouth. When the mouth isn't perfectly healthy, and it may look perfectly healthy, you may have great breath, you may say, I don't have cavities, I don't have periodontal disease. But if Dr. Stewart and his team or my team does a saliva test on you and looks for high-risk bacterial pathogens, we know that there are some aggressive bacteria that you can be totally asymptomatic, but they can be residing in your gum area. 50% of heart attacks are triggered by these oral bacterial pathogens. And this is just one of many studies demonstrating that these bacteria are aggressive. And they get into the bloodstream, as we mentioned on our podcast earlier, and in at least 3 different ways, they cause this thickening of the wall of the blood vessels. They find a way through that outer layer where the blood's flowing through the blood vessel. They can get through that first lining and take up residence, if you will, in what's called the intima media. Those are just the layers of the blood vessel, and that's where plaque lives, plaque and debris and bacteria. And so these pathogens, if they're identified, then the oral systemic relationship gets busy ensuring that you're protected, that your whole system is protected from these bacteria that are just silently, happily living there in your mouth and trickling down into your bloodstream, causing plaque to form. So just as you've mentioned, if somebody has a little bit low levels of oxygen at night, yes, if they have a bad heart, if they have severe atherosclerosis, they can die in the middle of the night because their heart just can't take it one more second without adequate oxygen. But you may be fine. You may feel fairly rested the next morning and you may go do your normal workout. But what you don't know is that overnight, your artery walls have been damaged because of these dips in oxygenation that can occur. combined with the fact that some of these bacteria are just happy as they can be in the wall of the artery, causing the wall of the artery to thicken and develop plaque.
Now, are these the bacteria that we're talking about? Most of them are, I'm assuming, anaerobic bacteria, meaning they thrive in a low oxygen or no oxygen environment.
Exactly.
Yeah.
And they are aggressive. That's true. And, in the media, more and more PG, Porphyromonas gingivalis, is getting more attention. Perhaps some of the listeners have heard of that one in particular because of all of Dale Bredesen's work and Dr. Perlmutter and our colleagues in the neurologic world and the Alzheimer's disease reversal world that have made it clear that there is no question that bacteria is implicated in the development of amyloid plaque and Alzheimer's disease and dementia. So it has to be identified and eradicated before you get systemic implications from that systemic damage. One of my colleagues, Laura Hooper, a registered dental hygienist that's expert in the oral systemic connection, has coined the phrase airway to pathogen to plaque, because it's really those three categories that are key. So back in the days when I was seeing someone in the office and saying, here's your statin for your cholesterol, we'll see you in 6 months, call me if you have chest pain, it's just unfathomable to me that so many people are still practicing in that manner when you're leaving all of these root causes unidentified. And the top ones are just what we talked about. Airway issues can lead to oral bacterial pathogens or vice versa. They sort of thrive off of each other. And then that leads to plaque. So be thinking, as you're thinking about, am I getting an adequate workup for prevention of heart attack and stroke, either your first one or a future one if you've already had one? Is my dental team and my preventive focused cardiovascular team looking at oxygenation, airway, effective breathing, and at these bacterial pathogens? In this slide, you'll just see the person with the flame coming out of his mouth. We just threw that on the slide because it is inflammation that drives disease. These bacterial pathogens get in the wall of the artery, and that wall of the artery gets inflamed, causing the thickening that we're talking about. And then above those pictures of the gentleman with the flame coming out of his mouth is just examples of what a test result would look like if you get the saliva tested to see the bacteria. And really, I could give an antibiotic. That would be totally the wrong thing to do, for me to just give a systemic antibiotic and not send this person to a dental team such as yourself. Yeah. Because I say that because we have some single-minded colleagues who perhaps would practice that way. So if you're an advocate for your own health and someone has said, here, I can give you an antibiotic for that and it'll be fine, go on down the road and find somebody that's going to collaborate with a team of dental experts to look for areas that need to be addressed beyond just throwing an antibiotic at it. Really, this whole approach to life-saving work is continuing to ask why, right? Yeah, like not just, I have a bacteria, so I'll take an antibiotic and move on with my life. You have a bacteria, why? Exactly. Why is it there? Yeah. Okay, well, go to see Dr. Stewart and his team. They can find out why, and they're going to keep asking why until they get to the bottom of why, and not only eradicate the pathogen or reduce the burden of it, but get to the root cause. Yeah, antibiotics are great. I mean, if you've got a massive infection and you need to get that cleared up, but whatever caused the massive infection, if you knew it was, say, you went to Mexico and you drank some bad water and you got a bad antibiotic, or bacterial infection, you would stop doing that. So the antibiotic is a one-time thing, but then you're going to stop the activity that caused that, if you're smart. But if you've got these really, really nasty pathogens in your mouth and you didn't even know they're there in the first place, and you take an antibiotic for it, what's going to keep them from coming back? So that I love that approach, because your approach is identify the why, treat that, then you don't have step one of a chain of events that's going to lead to something worse. Tell me a little bit about a lower oxygen level, difficulty in breathing, labored breathing. And I will tell you this, you probably, if you follow this podcast regularly, you've heard me say this and many of my guests over and over again. If you
hear your bed partner sleeping at night breathing, if you hear your bed partner breathing, if you can hear them breathe, they have an obstruction. Whether it's snoring, whether it's gurgling, whether it's just heavy breathing, they have an obstruction. Your breathing at night should be like sitting by the banks of the Mississippi River, this big wide river with this water just flowing smoothly, not sitting next to the White River in Arkansas just as it's coming out of the bottom of Bull Shoals Lake. And I may have got the lake wrong there, but you know what I mean, the white rapid water. You don't want to hear people breathing. That's labored breathing. And the more labored the breathing is, the less oxygen saturation. And we know sleep apnea and sleep breathing disorders, it's more about just oxygen saturation. When we look at a sleep study, we look at a multitude of factors, but specific to what we're talking about today, if our oxygen saturations are dipping dangerously low several times during the night, that's these really nasty pathogens that end up causing us to form plaque in our hearts and arteries and have heart attacks. They thrive in that kind of environment.
Absolutely. They thrive in that kind of environment. And so you have several factors at play. One is that, as I was saying earlier, these aggressive bacterial pathogens are just as happy as they can be, damaging your artery walls the entire time and damaging your cells. But also, your body is going to try its best to protect you. So when you're not breathing and oxygenating well, as you've just described, you know, and I'm sure I've talked about on this podcast before, how, for example, nitric oxide is lower. And nitric oxide, I like to talk about it like nitroglycerin. So if any of you know somebody who has chest pain or has a heart condition and maybe they carry nitroglycerin with them and they have chest pain, they take a nitroglycerin under the tongue. Nitric oxide is our own internal nitroglycerin that we naturally develop, naturally have. We want adequate amounts of it all hours of every day, every minute of every day, if you will. Our arteries love to be, I say, bathed in nitric oxide. We have to have that for the arteries to be nice and relaxed and elastic and able to dilate. So when you have reduced nitric oxide due to reduced oxygenation at night, the arteries constrict because your body is going to try to protect the brain, protect the heart at all costs. So you may not be getting adequate blood supply to the kidneys, to the feet, to the liver, to the other areas, because the body knows at all costs, let's constrict the blood flow there and try to open it up to the brain and the heart. All the while, your body is screaming for nitric oxide. And as you can imagine, even though you may feel fine the next morning, particularly if you're a younger person who's able to have this resiliency. But just know that overnight you've had cell damage. It may not be noticeable tomorrow and it may not be noticeable next week, but all of these things are measurable if you would just do some prevention tests early to keep this havoc from occurring. And then just taking it one step further back, if you will, I love to hear you talk about seeing children in your practice. So it just makes sense. If children who are not oxygenating well, which you can speak to more eloquently than I, but we're identifying it earlier and earlier. So if children who are not oxygenating well at night are having trouble focusing in school the next day, part of it is that they're not getting adequate sleep, but part of it is this problem with not enough oxygen delivering the life-saving nutrients to the brain. And a whole host of other health conditions that left unchecked for years and years and years. These are people that later in life have early stage dementia, early onset cardiovascular disease, etc.
So you've talked about nitric oxide, and we've talked about that before in our podcast, but I'm going to really reach here, but it's really the truth. The position of your tongue can determine a long way if you're predisposed to having a heart attack or not. What? The position of my tongue?
I love it.
If you're breathing through your mouth, you're not getting nitric oxide. You're getting unfiltered air. Nitric oxide lives in your sinuses and the nasal passages. And the only way it can get into your air, the air that goes into your lungs, the only way it can get into your lungs is by air coming through the nose. So breathing through the nose introduces this miracle chemical called nitric oxide into our lungs, which dilates the vessels, which helps us absorb many more molecules of oxygen, about 30 to 40% more than we would if we're breathing through our mouth. So I love that you brought up nitric oxide. That's a whole podcast in and of itself, just talking about nitric oxide. Gina, this has been great. Again, we're going to have you back. Definitely going to have you back. You've got a lot of great information. If you are interested in really pursuing total health and wellness, you need to see someone like Gina, like Dr. Pritchard, and her contact information is at the bottom of the screen. She's in Frisco, Texas. And Gina, thank you so much.
Thank you.
It's an honor for me to be able to interview and have relationships, professional relationship, and colleagues like Dr. Pritchard, because we're all in this for one reason, and that's to help all of you out there live better and be better husbands and wives and daughters and sons and mothers and fathers. We want you to, everything you do, we want you to thrive. So thanks for being on the team, Gina.
Thank you. Thank you for having me.
So this kind of leads into my song. I'm picking the song this time. Let's play it. Let's play the song. Health and Harmony Beyond the Teeth.
And hot French fries and friends around the country, from Charlottesville to good old Santa Fe. When I think of you, you still got on that hat that says let's party. I hope that thing is never thrown away. I hope that life without a chaperone is what you thought it'd be. I hope your brother's El Camino runs forever. I hope the world sees the same person that you've always been to me. And may all your favorite bands stay together.
I love this song. What is it, the Irish, what is it when they say, may the road rise up to meet you? What's that called? A blessing or... So, you know, growing up in the 70s and being in high school in the 80s, well, I graduated high school in the 70s. I graduated in 1980, so I guess that qualifies. I was in high school in the 80s. You know, we did all these crazy things, you know, your brother's El Camino, you know, I mean, we used to, you know, the guys had certain cars and we always lived to go ride around in them, or their big brother had a car. And this song is so wonderful. I just had a patient yesterday, a new patient. I went to high school with their son, and I had not thought about, we were friends, but not, you know, great friends, but always really admired the guy and liked him, and hadn't thought about him in, you know, 30 years, 40 years? And his parents come in, and it just got me thinking about this song, about old friends. And, you know, every phase of our life is there for a reason, and we may lose contact with people, but people that do have an effect on who we become, and we may never see them again. You know, we spend 4 years in high school, hopefully just 4 years in high school. Some people spend 5, maybe 6, but we have these friends, we have these people that affect the way that we live the rest of our lives, and they can have a profound effect on us without even knowing it. And what we hope to do is have a profound effect on our patients.
Yes.
I think that they probably would know it because by the time they come to see us, they know that they're serious about, you know, living the rest of their life. But anyway, once again, it's been a great day, great interview. Gina, thank you so much for being with us. And
thank you for
we'll see all you guys next time. This has been Health and Harmony Beyond the Teeth with Dr. Hal Stewart and our guest, Dr. Gina Pritchard. Wishing you health and harmony and happiness. We'll see you next time.